George was a successful college student. He dreamed of a long and happy life. However, he continued to make dietary decisions that reduced his chances of making that dream a reality. In particular, George never ate whole grains and always stuck to products like white bread and white rice over whole wheat bread and brown rice. As a result, later in life, George developed heart disease, needed heart medication, and eventually surgery. Developing heart disease cost George an extra $18,000 a year in medical costs. This is an average cost for a patient with heart disease. These extra costs put George and his family in debt. Because George continued to not feel well and was re-hospitalized, he fell behind in work and missed out on a promotion he had worked hard toward for years. Let's pretend we could turn back the clock to before George developed heart disease. Do you think George could have significantly reduced his risk of getting heart disease? If you answered it was preventable, you would be correct. The Institute for Health Metrics and Evaluation at the University of Washington combined data from every single study that passes quality checks that compare people who consume more versus less whole grains on average, and measure the differences in the development of chronic diseases. For example, if the study had a small sample size, as below 20 participants, the study was excluded. 61 studies in total passed quality control. What George didn't know, and what you may not know, is how important lifestyle behaviors are to the likelihood of developing a chronic disease such as diabetes, heart disease, and cancer. In particular, diet. What may surprise you further is the dietary factor that has the biggest impact on your length of life. If you are thinking of fruits and vegetables, you would be wrong. The data shows that not eating enough whole grains has the largest impact on early death and getting a chronic health condition compared to fruits and vegetables, by a lot. Regardless of your medical history, you are more likely to develop a serious health condition, for example, cancer, diabetes, heart disease, that reduces your length and quality of life if you do not eat enough whole grains. Further, over 95% of Americans consume less than the recommended 48 grams of whole grains a day. A whole grain contains far more protein and nutrients compared to a refined grain. A whole grain contains 3 parts: bran, germ, and endosperm, whereas a refined grain is missing 1 or 2 of these parts, minimizing intake of valuable antioxidants, B vitamins, fiber, protein, and minerals. According to the Mayo Clinic and Harvard School for Public Health, this extra nutrition helps control cholesterol levels, blood pressure, improve insulin sensitivity, glucose metabolism, and thereby prevents blood sugar spikes. Because the nutrients in whole grains slows the absorption of food, it also makes you feel fuller longer, helping with weight loss. Imagine if George learned how important whole grains are years before he developed heart disease. George would have probably made healthier decisions. He might have searched for 100% whole grain packaging labels and the number of whole grains listed. He might have chosen brown rice over white rice, 100% whole grain Cheerios over regular Cheerios, whole grain pasta instead of white pasta, or oatmeal versus refined grain cereal. There is little difference in cost between whole grain products and refined grain products. In fact, sometimes they're even cheaper. How does this list compare to yours? The Department of Agriculture recommends eating 3 servings of whole grains a day, or put differently, 1.5 cups of cooked brown rice, whole wheat pasta, or oatmeal. What if you, like George, don't like the taste of whole grains? Well, our taste buds change, and our brains can adjust to new flavors. For example, many people grow to enjoy the flavor of coffee over time. You can also add whole grains to something that you already enjoy. For example, wild rice to soup. If a product has a whole grain stamp, then it is easy to identify how many whole grains are in each serving. In the absence of the stamp, look at the ingredient list. If the first ingredient is enriched flour, wheat flour, bran, or wheat germ, then it is not a whole grain product. If whole grain, for example whole wheat or whole rye, is the first ingredient, then it is most likely a whole grain product. After George incorporated whole grains into his diet, he was surprised to find out, like many, that in addition to a longer lifespan and disease prevention, eating more whole grains as part of his healthy diet helped with his weight loss, stress management, concentration, energy, cognitive performance, and finally, a positive mood. Incorporating more whole grains can be done by making small but powerful changes. Your whole grains are waiting for you.